Good morning. Real positive story. Lady doctor, she is a consultant, obstetrician, medical doctor, and she fixed CGM, which is continuous glucose monitoring, and she record her blood sugar level, and it was low, it was normal, 4.6 millimole, 5 millimole. Only once it rise to 6.5 millimole because she was on holiday. But when she went back to work, she noticed there is a rise in the blood sugar. The spike is 10.6 after eating. So I asked her to give me the start of her eating window. It was 1 p.m. and she finished eating window. The last bite was 7 p.m. So it is 6 hours. And during her stay in hospital and shift, which is usually for doctors, is 12 hours. And she did cesarean section, and there was a patient who came with shouting, with pain. So this affected her blood sugar. So anyway, so the analysis of her result is as follows. It was 4.6 when she started eating because she practiced intermittent fasting, and also she practiced healthy lifestyle, which is doing exercises in the morning with a personal trainer before going to work. And she tried to do healthy lifestyle, very good, for the last 6 years. And now the blood sugar rise to 10 after eating. The spike is too high. I mean, if she is really insulin sensitive, it should be less for her, because she is worried because her mother is diabetic and she had cancer of the breast, which was in one breast, which was stage 0 or stage 1, and it was removed. Okay, so she tried to prevent diabetes and prevent cancer, which feed on glucose and sugar. Anyway, so the analysis of the food, it was good, green leafy vegetables, but she had 1 apple and 1 clementine, which is also contains sugar, and pumpkin seed, which is also sugary. But the point is, my advice was, if she shortened the eating window from 6 to 3 hours or 4 hours. But we have problem because eating greens, it takes time to chew. And I admit that. So, number 2, the timing, if she stopped eating at 4 or 5 p.m. instead of 7, it is more with the biological clock of our bodies. And the insulin is, the cells are more sensitive to insulin during the day than at 7, when it become evening and sunset. Number 3, to try taking 1 tablespoon apple cider vinegar before the meal, and then check the blood sugar, do experiment. And also to try 1 tablespoon of apple cider vinegar, organic, after the meals and see. Number 2, the other advice was to run, to hit, even in the hospital, to get out in the garden and run for 10 minutes. And to see how the blood sugar will respond and how the blood sugar will go inside the skeletal muscle and reduce it in the blood, because the muscle are sink for blood sugar. Number 3, to take a red light, a lamp, which is portable, 670 nanometer, and expose her back to the red light for 15 minutes. And this is from the experiment of Professor Jeffrey in London, which found that the blood sugar is reduced by 30%, but it sustained lower blood sugar by 7.7%. So we will do this experiment, but she is not bad. She was very worried, but I reassure her it's very good. Even the spike is 10 and it lasts 3 hours. Ideally speaking, the blood sugar should come down within 2 hours. Yeah, so she is perhaps pre-diabetic, but she can do this by timing, by doing exercises after food and taking apple cider vinegar and red light. So we could mitigate the damage and the high blood sugar. This is a lesson for all of us to learn how people now they are using CGM and it is getting cheaper and cheaper because more people are using it, especially diabetic type 1 and type 2. Thank you and goodbye.